So basically, a surgeon and a physician are basically are divided after MBBS. So if you are interested in looking at the medical problems of the patient, so then you go into a medical super specialization. If you are looking at the surgical problems, you go into a surgical super specialization. So these are completely two different sets of pursuits actually. So if you can think of medicine as a craft, so it's as different as a plumber and a carpenter basically. So my wife is a surgeon. She does not know anything about medicines actually, and Varun's wife is also is a surgeon. So they do not know much about medicines actually. So they focus on operating on patients. So basically, these are completely different subjects, and only up to the MBBS, the training is similar for all of us basically. And after that, it starts branching out. So, coming a little bit about endocrinology, our combined specialization is endocrinology. So, we'll ask both Dr. Lakshmi and Dr. Varun their experience, how they got into endocrinology, when they got interested in endocrinology, how they joined, like that. So each person has their own individual journey. It's very interesting to note that actually, and it gives a lot of information for aspiring doctors and even for general public. So it gives us a lot of information about that. So we'll start with Dr. Lakshmi.
So very early in my MBBS, when we are doing dissection and things like that, when we are rotating through surgical. So in MBBS, we do rotate through medical and surgical specialties. And very early, I found out that I'm not very good at surgical skills. So that's something that that's a limitation that I recognize. And I was good at solving medical problems. So I was good at taking history, examining patients, and solving the complex cases, making a diagnosis. So I was good at that. So very early on, I decided that I'm going to take a medical specialty, and medicine was always interesting for me. You come across medicine in your final year of MBBS, and so basically, like you are doing detective sort of work, trying to find out what the diagnosis is. Many patients with complex symptoms. So I was interested in medicine, so I wanted to do medicine. And during medicine, very interestingly, we do rotate through super specialty departments in medicine. Like we have rotation in cardiology, nephrology, we have rotation in neurology. Endocrinology is one rotation that I didn't have at my hospital where I trained in, and it was always very intriguing to read about it. Hormones, they are these things that you can't really see, but they're affecting every system in your body. And the endocrinological cases, the core endocrinology cases that we see, apart from diabetes and thyroid, are so rare. And when you see them, once in a few months, maybe I used to get so excited. For example, there's Cushing's disease, which can cause secondary diabetes and weight gain. And when you actually come across such an interesting and rare case, it makes you so excited. It can make your whole day exciting, and I think that is what got me excited in endocrinology.
During the MBBS, again, like the most of the subjects that I liked were like medicine, internal medicine, and pediatrics. The primary reason being, so we'll have, I mean, these are like solving a puzzle. We have to take history, then come to a diagnosis, and most of the medical conditions will have like a significant improvement without any surgical intervention, and some of them miraculously improve. Especially like I did my MD in Chandigarh. It has got a very good endocrinology department, and I was lucky to have significant, almost like I had 5 months of endocrinology postings during that rotations. So I had exposure to such cases, and I started liking the endocrinology towards the MD. Then I decided to go to pursue endocrinology.